Hello everyone, welcome back to my channel. If you are new, hi, my name is Alyssa, and here we talk all things true crime related. Today's case is still ongoing as of me filming this, so because a trial or plea has not happened, everything we're going to be discussing today is alleged until proven otherwise. Again, I have to say alleged as I was not there. But we're going to be talking about a plastic surgeon by the name of Benjamin Jacob Brown, whose negligence potentially could have caused his wife, Hillary Ellington Brown's death back on November 28th of 2023 in Gulf Breeze, Florida. And you guys, I was mind blown researching this case and finding out what this doctor did and did not do while performing plastic surgery on his wife. So with that, let's get into it. Hillary Ellington Brown was born on September 2nd, 1990 in Mobile, Alabama to her parents, Marty and Dixie Ellington, who she was very close to growing up. She also grew up with one of her siblings, her brother, Joseph Ellington, and Hillary loved spending time with her family, but specifically her father, where they would bond over their hobby for hunting. It was said that Hillary was full of fire and energy since she was a young girl. Eventually, she would attend Oxford High School in Michigan, but ended up graduating from North Delta High School in Mississippi. She then went on to pursue a Bachelor of Science in Chemical Engineering at the University of Mississippi. Hillary had 2 daughters and a son from a prior marriage and was a devoted mother to her littles. I mean, they were everything to her. Now, Hillary would end up meeting Dr. Benjamin Brown in 2021 when she went into his plastic surgery office for a breast reduction consultation. They ended up getting married the following year of June of 2022. Dr. Brown also had 2 sons from a prior relationship, so together they were a family of 7. Dr. Brown appeared to care for Hillary's kids and took them in with open arms, and this had her family feeling like they were in good hands. Hillary enjoyed the fact that her husband would regularly perform plastic surgery procedures on her face and body. Here are some before and after images, and I think it's apparent some changes were made, but absolutely no judgment here. Hillary enjoyed that he could do this for her. Her family, however, did not feel the same way and believed Dr. Brown was stripping Hillary of her natural beauty. It was also said by a friend that he was trying to make Hillary look like Megan Fox. Hillary would end up working at his practice, Restore Plastic Surgery in Gulf Breeze, Florida, where staff and clients praised her sweet, cheerful personality. As time went on, shortly after getting married, Hillary showed indications that she was unhappy in her marriage, but she wanted to make the relationship work. Her family would catch on regarding the instability in the marriage because there would be constant yelling and cussing between the two. So Benjamin Brown ended up graduating from Georgetown University's Department of Plastic Surgery in 2015. He actually ended up getting his license in a few different states such as Florida, Virginia, West Virginia, and Washington, D.C., and holds a certificate by the American Board of Plastic Surgery. Now, we're going to talk a bit about Dr. Brown's practice, Restore Plastic Surgery, because this case heavily involves his practice. Around 2021, one of the medical assistants that worked for Dr. Brown started noticing a decline in his practice where Dr. Brown would delegate a lot to his physician assistant and his unlicensed wife, Hillary. In Florida, since the Department of Health only does annual inspections at offices where the doctors perform level 2 and level 3 procedures, Dr. Brown's office did not undergo these inspections because he performed level 1 procedures. So basically, the practice was not inspected by the health department, so the office was said to be dirty and poorly maintained. He also simply did not listen to his patients. For example, a 40-year-old woman had a consultation with Dr. Brown and discussed wanting to get a breast implant replacement, tummy tuck, liposuction, and fat injections into her hips. And Dr. Brown had recommended also getting gluteal fat injections, commonly referred to as a Brazilian butt lift, but the patient told him she was not interested. However, when she went to the hospital to get her first round of procedures, Dr. Brown decided to inject 1,100 milliliters of fat into each buttock, which again, this procedure was not authorized by the patient. And I can just imagine what this patient was thinking when they woke up from surgery. It was also said that surgical staff would not wear masks during procedures where patients would undergo exposed wounds, and also would wear jewelry under their gloves, which is not sterile. The office did not have any life-saving equipment, so if anything went wrong in these procedures, the patients were at huge risk. Also, I just want to note this really quick, but allegedly Dr. Brown would give Hillary higher doses of medication than what is recommended for her weight, and in one of these instances, he struggled to wake her up, and this really freaked out his staff. The staff also noticed that Dr. Brown did not follow proper protocols at his practice and simply did not care about his patients, which led his physician's assistant to basically pick up all the patient care. One of the PAs even described that the practice became a wound care facility because patients were constantly coming back with infections. This would happen as often as every day, 7 days a week, and it got to the point where the staff started to feel helpless. Now, I know there's risk to every procedure, but I don't know if it's common for patients to come back this often. Also, the medications in the office was just in a drawer in Dr. Brown's office, not locked up, basically giving anyone access to them. It was said that Hillary would actually perform procedures on other patients, such as laser treatments, injections, and removing stitches, but remember, Hillary did not have a license to do this. Weirdly enough, Dr. Brown's practice would win the 2022 Best of Bay Award. So, at some point his practice appeared to be operating successfully because the public votes for these winners. However, at some point his practice would be hit with many civil lawsuits from patients alleging shoddy work. On November 21st of 2023, Hillary went into the office to undergo a miniature muscle application, abdominal scar revision, bilateral arm liposuction, lip injection, and ear adjustment procedures. And I am in no way a medical professional, but I can just imagine the stress one of these procedures would cause on the body, and she was getting all of them done at the same time. To make matters worse, Hillary also allegedly prepared her own IV bags that was used as a local anesthetic, and ingested a handful of multicolored pills, which included the sedative Valium, which I guess is normal for patients to be given a medicine cocktail before procedures. But Hillary allegedly helped herself to these medications because, again, the medications in the office were not locked up. Now, since I am not in the medical field, I can only guess that it's maybe not normal for people to prepare their own IVs, but Hillary didn't even have any formal medical training on how to do this. When Hillary went into the operating room, Dr. Brown administered additional anesthesia and failed to record what anesthetic medication and dosage that he gave to her. And I guess this was common for him where he would not document procedures properly. Now, this part makes my skin crawl, but after Hillary's initial scar revision surgery, Dr. Brown allowed Hillary to suture her own skin. Okay, we're just gonna keep going. Next, he began to liposuction one of her arms, and at this point, Hillary became restless and her feet began twitching. She then even told her husband, now remember, this is her husband that is doing all this to her, okay? Hillary then told Dr. Brown that her vision began to blur and mentioned she started to see orange. And now, despite Hillary showing signs of lidocaine toxicity, he continued on to the third procedure of giving her lip injections. So she's restless, feet are twitching, seeing orange, and he just continues on. Like, what? So when the IV bags that Hillary prepared for herself ran out, he proceeded to pour 2 containers of another anesthetic into a sterile bowl without diluting them and began to just inject her arms and face to numb the areas. So specifically her lip and eyes. Hillary now is communicating that her vision is starting to blur and her face became visibly puffy. As Dr. Brown injected her right eye, Hillary then became unresponsive and began convulsing on the operating table. At this point, several employees there asked Dr. Brown if they should call 911, and he kept saying no or wait because he wanted to try and do it himself. As this was going on, Dr. Brown began yelling at his staff, asking which medication she took, the handful of multicolored pills. Also, he was ordering his staff to find an oxygen tank and stethoscope, but no one could locate these critical supplies. He had no life-saving devices or a crash cart in the room. After about 10 to 20 minutes, around 4:15 p.m., one of the staff members ended up calling 911, but not at the discretion of Dr. Brown.
Call reported a 32-year-old female was undergoing a procedure for a lipo fat transfer.
When police arrived, they found 33-year-old Hillary suffering from cardiac arrest. She was then taken to an emergency room in Navarre, Florida, where she would be stabilized. From there, she was transported to the intensive care unit at Sacred Heart Emergency Care Department in Pensacola, Florida, and was put on life support. During this time, Dr. Brown showed signs that he cared more about his money than his wife's life. For instance, he texted Hillary's father stating that Hillary's time of death needed to be before November 30th because the insurance benefits go away after that. Also, Dr. Brown already started to sell everything, basically trying to close his business and file for bankruptcy. He was also putting some of Hillary's personal items up for sale, such as her ski boots, and claimed he was selling them because she didn't ski anymore. Like, could he have picked a worse time for a closet cleanout? He even expressed to Hillary's father that he wanted to go buy a new vehicle before his credit tanked, and her dad was in the hospital room with his daughter who is dying, and her husband is just going on a rant about his business and credit, showing no care for his wife's life. And to make it worse, he never told her family that he was sorry or messed up, basically taking no accountability for his actions. Unfortunately, a week after, on November 28th of 2023, Hillary would end up passing away, less than 2 years after meeting who she thought would be the love of her life. Hillary showed signs of lidocaine toxicity while she was undergoing all of the procedures. Her death was later determined to be, quote, complications following lidocaine toxicity. 7 months after Hillary's death and an extensive investigation, an arrest warrant was signed by a judge on Friday, June 14th of this year, 2024. Then Dr. Brown turned himself in to authorities on Monday, June 17th, where he was formally charged with second-degree felony homicide, manslaughter by culpable negligence for his wife's death, in which he intends to plead not guilty and will put up a fight in court to defend against the allegations. So you might be wondering why it took so long, 7 months, for Dr. Brown to get charged, and it's because investigators did not get the final report from the medical examiner until May 15th of this year, 2024. Following the investigation, the Florida Department of Health issued an emergency order immediately restricting Dr. Brown's ability to continue practicing medicine. The board even stated, quote, the level of disregard Dr. Brown paid to patient safety, even when the patient was his wife, indicates that Dr. Brown is unwilling or incapable of providing the appropriate level of care to future patients. End quote. If convicted of second-degree homicide, Dr. Brown could face up to life in prison, life on probation, and a $10,000 fine, which I feel like is nothing for him, so that kind of angers me, but he is denying all allegations of wrongdoing and has retained counsel to defend him. So Dr. Brown is facing the criminal manslaughter charge as well as the health department's request to the Florida Board of Medicine to penalize Dr. Brown for his conduct with his wife and other patients. The penalty being to suspend or revoke his license. And his practice, Restore Plastic Surgery, has 2 malpractice lawsuits open against them, but only one of those has Dr. Brown as the defendant. As of filming this, a trial has not been set yet, but Dr. Brown was released from jail after posting a $50,000 bond the same day he turned himself in to authorities. His family did issue a statement basically saying that these allegations are misleading and inaccurate, but in my opinion, the facts do not lie. As a result of this case, Florida Republican representatives are now calling for changes in state legislation to help prevent potential similar cases in the future. Hillary's family is also working with state legislators to develop Hillary's Law, and one of those representatives, Alex Andrade, has spoke out supporting legislation when it comes to putting measures in place where physicians would not be able to perform operations on family members, and also is committed to filing a bill in Hillary's honor. And I completely agree with this stance for several reasons, such as conflict of interest, informed consent, and so on. But one I wanted to speak on that is relevant to this case is quality of care, meaning there's a risk for medical decisions to be influenced by emotion, like by emotional ties rather than medical necessity. I obviously do not know what Dr. Brown's intentions were when he was performing these various procedures on his wife, but it is definitely scary to think what went on in that room. Hillary's father spoke out about Dr. Brown's ego, which he believes caused his daughter's death, stating, quote, his ego and arrogance overshadowed the need for help, prolonging oxygen deprivation to her brain and ultimately caused her death. Ben Brown took the mother from my children, my only daughter, and our brightest star. Hillary gave the ultimate sacrifice so Ben Brown could not hurt anyone else. Maybe in prison he will get the attention he deserves, end quote. And just so well said. One item I wanted to know is that Hillary ended up choosing to be an organ donor, and due to the sacrifice, her organs were transferred to 5 patients that now had a chance for a restored life. I did run across a picture that really made me tear up, being that I am a mother. Because I think it's every parent's worst nightmare to have to see their child pass away before them. But Hillary's father shared a picture of him holding Hillary as an infant, then the moment he was in the hospital holding her hand after she slipped into a coma. And I can just imagine the sadness her father felt in those moments. and her other loved ones that were there as well. My heart goes out to Hillary's family as they pursue this battle for justice. Hillary will always be remembered as the loving, caring, and supportive mother, daughter, wife, sister, and friend that her friends and family describe her to be, because in the end, Hillary's life, impact, and story matter. As always, I will keep you updated when more information comes out, but that is all for today. Thank you for watching, and I will see you soon.